Specifically designed for interphalangeal fusion, the Smart Toe 2 offers accurate positioning, rotational stability, and dynamic compression across the joint. PIP sizes include 19mm and 16mm in both neutral and 10 degrees of flexion. The DIP option is available in 11mm and 13mm neutral only. A standard linear or transverse incision is used to expose the PIP joint. Resection of the head of the proximal phalanx should be limited to 2 to 3 mm to ensure a successful outcome. Once resected, a 2 mm calibrated reamer is used to prepare both the proximal and middle phalanx. Proximally, the reamer is advanced until the cutting flutes are buried into the proximal phalanx. Distally, the cutting flute should advance halfway into the middle phalanx. A separate reamer is provided to prepare the base of the middle phalanx. Cartilage is removed and subchondral bone is exposed. T-handle brooches are provided and labeled for the proximal and middle phalanx. Use the corresponding brooches for final preparation of each intramedullary canal. Once each side is prepared, a final check is done to ensure congruent cuts and adequate preparation has been accomplished. The Smart Toe 2's design provides rotational stability that aids healing time and proper toe alignment. The Smart Toe 2 also features dynamic compression. This continuous compression across the joint provides an environment for enhanced healing. The Smart Toe 2 arrives packaged for proper implantation. This includes an accurate positioning locator option. The position locator ensures accuracy during reduction and ensures proper implant proportioning alignment. Using the provided forceps, the Smart Toe 2 is removed from the blue disc and carefully inserted into the proximal phalanx until the forceps are flush with the proximal phalanx. The forceps are left in place and the middle phalanx is reduced over the Smart Toe. Leave the forceps attached to the Smart Toe until the middle phalanx is reduced. Once reduced, the forceps are removed and the joint is manually compressed to ensure congruent bone-on-bone contact. Use the supplied position locator to accurately control depth of insertion into proximal phalanx while reducing middle phalanx. The position locator is removed once the joint is fully reduced. Hold the toe for 30 to 45 seconds to allow for expansion. After the Smart Toe 2 is implanted, it is important to check for adequate correction. If adequate correction is not achieved, a secondary procedure should be implemented. This procedure can range from soft tissue release to a Weil osteotomy. During the Weil osteotomy, a linear cut is performed into the metatarsal head. The head of the metatarsal is repositioned proximally and fixated with 1 or 2 screws. Screw sizes can range from a 2.0 to a 2.5 millimeter. The Smart Toe 2 system also features the new DIP implant. The DIP implant is available in 11mm and 13mm size options in a neutral angle. The Smart Toe 2 DIP is designed for DIP fusions due to mallet and claw toe deformities.